This is Brian Wormers recording a lecture for medical surgical nursing covering the care of patients with eye and vision problems. So some of our main learning objectives are listed here, and those are also listed on your PowerPoint. One of the things that we can see is blepharitis, and so this is more common in older adults that have dry eyes, and you get kind of a crusting here. This can lead, this is a blockage of the tear production, and it leads into a bacterial infection. You get some inflammation along this edge right here, and it kind of leads into itchy, red, and burning eyes. You can get seborrhea, which is greasy scales and mattering. And basically, for treatment of this is using warm, moist compresses and then scrub it gently with some baby shampoo. Don't rub in the eyes, but just along those eyelashes to get those crusting out. Entropion, so this is turning inward of the eyelid, causing the lashes to rub against the eyes. It's common in older adults because of the loss of tissue support and conductive tissue. So it causes redness of the conjunctiva, and surgery is the way to correct this. Ectropion is opposite. It's turning outward and sagging of the eyelid, caused by relaxation of the orbital muscle, which is also common with older people. So the bad thing about this is it decreases the effectiveness of tears and can lead into corneal drying and abrasions. So once again, this requires surgical interventions. This is a good depiction of what normal is, what ectropion is, and what entropion is. Hordeolum or styes can be external or internal, but you're seeing this redness, the swelling right here. So it's an infection of the sweat glands or the sebaceous glands, and treatment of this is warm compresses. Chalazion, it's very similar to a stye, but it's just a little deeper. It protrudes a little bit inside the eyelid, and so with this you're going to get some eye fatigue, some light sensitivity, and excessive tears. Treatment, once again, it is warm compresses followed by ophthalmic ointment, and then surgery to lancet open once again is an option. Conjunctivitis is inflammation, but may or may not be contagious. So you can have infectious, such as bacterial causes, which we commonly label as pig eye, and you treat those with antibiotics. Oftentimes this is being diagnosed as being viral, and in those cases you got to take a wait and see approach to it. And then for all of these, good hand washing is key, and then also you have to tell them good instructions on how to give eye drops. Please refer back to your physical dimensions class to do that. That might be a key thing on your exam. Trachoma is often related to chlamydia. It's very common in third world nations, not so much in the United States, but it is one of the chief causes of preventable blindness in the world. Oftentimes what we do is after a child is born, we treat them with some erythromycin or silver nitrate prenatally. But some of the new studies are saying that this is not as effective as what it should be. Corneal disorders, so this is problems with the cornea and the refraction. So this can be caused from irritation, infection, ulceration, or degeneration. Some of our signs and symptoms, are going to be pain, reduced vision, photophobia, and secretions. So trying to avoid some of those, we might use antibiotics, antifungals, antivirals, and steroids, trying to calm the body down. Keratoplasty, so you're having a misshapen lens. So basically it's an outpouching here that bends and changes the refraction of the light. So surgery for this is often a regional thing. Postoperative care is usually pretty minor. We can also do corneal transplants for other things as well. And so basically you're just cutting, and then taking out that diseased section, placing a new one in, and letting it heal. Eye donation for these transplants, some of the main considerations are the donors should be free of infectious disease or cancer at the time. And then we don't get this from live donors, we get this from people that are usually meet brain death criteria. Cataract, so this is a clouding of that lens, and so as the image comes through, it gets kind of funky. So we can kind of see it here, where it just looks cloudy instead of a nice crisp black. Can occur at any age, can occur as a result of trauma, but it's also related to age-related cataracts. So surgery for this is basically inserting a probe, injecting sound waves, which is supposed to break up the proteins that are in there, and then suction out those pieces, and then leaving that capsule largely intact. Afterwards, we want to watch for these complications, and we also want to avoid activities that might increase interocular pressure, such as straining, so bending down, lifting heavy things, having a hard bowel movement. Any of that stuff can increase your ocular pressure. Glaucoma is an increased ocular pressure, and so we can look at these different areas, but basically you're talking about blood flow that's prevented, and so therefore you're getting poor oxygenation, and those cells then get ischemic and die. This could also cause cupping and atrophy of that optic disc, and some of your major signs and symptoms are going to be headache, nausea, vomiting, halos, and blurred vision. Glaucoma can be open angle, which is probably the most common form. It tends to be very slow onset. It's kind of insidious because you don't know you have it until you're already damaging things. It tends to be very asymptomatic in early stages. Late manifestations causes irreversible damage. So you lose your peripheral vision and you have decreased visual acuity then. Angle closure is not as common. However, NCLEX has liked to test on this for some reason. This is a sudden onset when the fluid cannot leave the eye, and it increases your interocular pressure. This is an emergency that needs to be dealt with immediately, and so do not wait on this. Drug therapy, so we can focus on reducing the interocular pressure by constricting the pupil, decreasing the production or increasing the absorption of that aqueous humor. So some of our main classes that we'll use: prostaglandins, adrenergic, beta-adrenergic, cholinergic, and carbonic anhydrase inhibitors. So make sure that we are given education just like we do with all of our other medications. And once again, talking about eye drops and how important that is. Macular degeneration. So this is on the macula, this is the area of the central vision. It deteriorates. And this could be either from atrophic age-related or exudative type of changes. But basically those rod and cone photoreceptors die. And with that, then you lose your central vision. So some of our main treatment of dry is trying to maximize the remaining vision, and wet is geared towards slowing the process, so stopping the leaking vessel from bleeding. Hypertensive retinopathy, so as blood pressure increases, it's really hard on the vasculature, and you get this copper wire appearance if you look through an ophthalmoscope. You get nicking or narrowing of those vessels, and if the blood pressure remains high, you can actually get cotton wool spots, which are basically hemorrhages, and those can cause headaches and vertigo. And if you get hemorrhages, then the blood is not going where it needs to go because it's leaking out. So eye trauma can be very common, and what we can see here is a hyphema, and so this is blood in the eye, and so you can't see the iris or the pupil. Basically, you're just seeing this line of blood all in this eye. You can get bruises, contusions, you can get foreign bodies like this fishing lure that's in this eye. You can get lacerations and cuts on those eyes, and you can also get penetrating injuries. So all these are emergencies. They should go in, be seen in the emergency department, and then subsequently treated by a specialist. Safety regarding reduced vision. Some of our interventions that we can do would be good communication about use of adaptive items. So instead of things that are visual in nature, we can do more auditory or more vibratory, and sometimes that will help. We can talk about safety in familiar settings, such as tripping hazards, any rugs, any cords, anything of that nature. We can talk about orientation within a room, in a patient's room. So, the bathroom is if you're in the middle of a clock and you're in the very middle of it, the bathroom is at about 12 o'clock from your current location. the nightstand is about 3 o'clock. That's where your glasses are. That's where your phone is. That's where your toothbrush is. You know, use a clock or use some kind of thing so they can identify where they're at and where they need to go. Help them ambulate and assist them with cares as needed. However, try to promote as much self-care and independence as possible. And then lastly, support them for any difficulty that they're having with adapting to a loss of sight, as this can be really hard on a lot of people. This concludes this lecture. If you have any further questions, please contact your professor.